Head O, Ministry of Health, Dr. Tan Wu Meng.
Mr. Chairman, I beg to move that the total sum to be allocated for Head O of the estimates be reduced by $100. I declare that I'm a medical doctor in a public hospital. In the budget debate, I spoke on stress tests for Singapore. COVID-19 testing us today, but we also need to prepare our healthcare system for tomorrow, test our plans for the future before the future tests us. I'll speak on 3 areas today: better care for an aging population amidst better care coordination, better access to treatments, and better support for our healthcare workers and frontliners. Sir, today Singapore's aging, more chronic diseases, patients with multiple medical conditions. I asked a written question in Parliament early this year: how many specialist outpatient clinic SOC visits a patient might have in just 1 year in our public hospitals? Here are MOH's figures from 2019, before COVID. Over 7,000 patients each had 24 or more clinic visits a year. That's 7,000 patients averaging 2 or more clinic visits a month. Over 2,000 patients each with 36 or more clinic visits a year. That's 2,000 patients, each averaging 3 or more clinic visits a month. Each visit means traveling to and fro. If you're less mobile, it might mean having to take a taxi. If you're still working, it might mean time away from work. For caregivers, time commitment too, and not every employer is supportive. And for some low-income workers, daily rated, each clinic visit means loss of income. I've met Clementi residents worried about this, but they also see how busy our healthcare workers are across Singapore, and yet without enough time, space, opportunity to fully coordinate the care, it's hard to reduce and simplify the number of visits and appointments and journeys across multiple medical teams when a patient has multiple medical conditions. Let me speak on the value of care coordination. I raised this back in 2009 in the Singapore Medical Association newsletter, the SMA News. Sir, in Cabinet, there are coordinating ministers. It recognizes that coordination is important, adds value in and of itself, beyond a single specialization, beyond a single ministry. Likewise, there's a role for the coordinating physician, someone who's walked with you for years, knows the ins and outs of your medical journey throughout your journey as well. And when the situation is complex, someone that can be a bridge between different specialists, different medical teams, not taking the place of individual experts, but bringing that holistic view, working with you, for your health and your care. Sir, in some cases, the coordinating physician might be a doctor who's known the patient for years, a specialist, a family physician, or a GP. But ultimately, it is a role that requires deep knowledge of the patient, deep understanding of the patient, a certain breadth of medical experience, and most importantly, depth of wisdom. It is high-value work. It takes time, takes effort, and it should be appropriately recognized and supported throughout the healthcare system. Sir, COVID's been very, very hard on our hospitals, and it would have been even harder without the help and support of our family physicians and our GPs in the community, on the community front lines. Supporting patients, helping patients recover in the community to help reduce the brunt of the COVID wave at our acute hospitals. I know some family physicians, including in Clementi, Some are themselves not young and faced considerable personal risk looking after patients in the early days of the pandemic, especially before there were vaccinations against COVID-19. Some have also asked about support, closer collaboration with our hospitals in peacetime and in crisis. Can it be easier for family doctors to link up with the hospital team, to keep updated on the mutual patient's conditions, or even to mobilize the resources of a hospital cluster, working with family doctors to help patients in the community? We need to keep our healthcare system fit for purpose amidst Singapore's aging population. And this means we need to find ways to support and empower our family physicians and GPs better. Help healthcare clusters and family doctors connect, work together more closely, make it easier for information to flow and be shared, to build that understanding of how best to care for a patient, so that care can be better coordinated amidst an aging population and patients with more complex medical conditions. Sir, let me speak on the healing power of therapeutic time, because empowering healthcare workers also means understanding the work, how much time it takes to deliver quality care. Sir, imagine sitting down with a friend, encouraging them to stop smoking, listening to their story, how they started, the challenges they face, persuading that person to change their lifestyle. It takes time. Quitting smoking, lifestyle changes, challenging conversations in a health crisis. These are not just KPIs or targets for policy. It takes time. Each healthcare worker has but 24 hours a day. Yet our time is one of the most precious gifts we can give to a patient. And decision makers and planners need to get even better at understanding how much time it takes to deliver quality care, whether face-to-face in clinic, on the telephone or through video conference, including after hours, connecting with different patient care stakeholders, different medical teams, coordinating, improving the patient journey. Because it's only when decision makers deeply understand what is needed that planning and policy can be implemented in a way that does the most good. It's like flying an airplane. Even the best pilot needs to know what's the airspeed, what's the altitude, how much fuel in the tank. So let me speak about technology and IT. In 2019, the last year before COVID, from public available figures, there were 14 million consultations across the public healthcare sector. Today, there's computers everywhere in healthcare, but we know that the computer systems can be improved, made easier to use. Imagine if healthcare workers across Singapore spent just 1 minute less waiting in front of a computer, waiting for a computer app to load, working with a mouse, data entry, grappling with technology. That alone, Mr. Speaker, would mean 14 million minutes saved in the healthcare system, 250,000 hours, 10,000 work days, or 27 years of someone working 24 hours a day. That's how much time could be saved. Those 14 million minutes could have helped our healthcare workers connect better with patients, building a care relationship to help someone stop smoking, or forging that trust through a healthcare journey, that trust which is needed in a mental health situation or when there's a life-changing diagnosis, a health crisis. It matters in a pandemic too. Every minute matters when there are many, many people sick, needing urgent care. So workspaces, IT, user interface, not a small matter. We must give it the same attention and focus in policy and implementation that the big firms like Apple and Google do. We've seen that GovTech can develop best-in-class user interface. Simple, elegant, gets the job done. Parking.sg, A small app, but it shows we do have these capabilities. Should we also have a higher ambition, designing and building our own homegrown national IT healthcare platform, best in class, competitive or better than what's available internationally, as easy to use as an Apple or Google app, built by Singaporeans for Singaporeans? And if we build something that good, we know that we can sell it to the world as well. Sir, on access to treatments, we know that by improving access to subsidies and MediSave, we help patients and doctors manage chronic illnesses upstream before they grow into a bigger healthcare crisis. Can CHAS and outpatient MediSave be streamlined further, access improved? On integrated shield plans, in September 2020, I'd spoken about this, how individual patients, individual consumers don't have the bargaining power to take on an insurer, even when there are asymmetric terms and conditions. How the invisible hand of the market can become unbalanced, and sometimes you need the visible hand of the regulator to put things right on an even playing field. Some Clementi residents have asked, why are IP insurers' panels of doctors so different from one company to another? May last year, SMA News reported one IP insurer for their panel of breast surgeons only had male surgeons, which meant a female patient, if needing a female breast surgeon in the private sector, would have had to co-pay more. But surely if a doctor is fit and proper for company A, presumably they're fit and proper as well for company B, unless the different insurers have made these decisions due to business considerations rather than clinical performance, in which case the insurers should be upfront, transparent with patients. I call upon MOH to continue looking at this to see how we can make the journey better for patients who have invested many years of their CPF, MediSave savings, or personal funds in IP integrated shield plans. On better medication prices, I also asked how we can ensure affordable access to new treatments like cell-based therapies, whether we can have cheaper, equally effective medications competing in the Singapore market amidst our FTA and intellectual property regulations. Can MOH provide an update? Sir, I want to speak on supporting our healthcare workers who have held the healthcare system together amidst the pandemic. More than 2 years, working guts out, day in, day out. On our nurses and our allied health sisters and brothers, I've previously called upon MOH to look at paying our nurses more. Last year, then Finance Minister Mr. Heng Swee Keat announced improvements, but there is still room to look further at raising the remuneration of our nurses and our allied health workers. Because what our nurses and allied health sisters and brothers do is essential work. Deep skills, physical, mental, emotional labor, reducing the burden of suffering for patients and patients' families. It's important work. And so I call upon this government to do a deep review, see what more can be done. Because how we budget, how we formulate manpower policy, it is not just a question of market forces. It speaks to the values we have, what we hold dear, and to the direction and message we want to send for our society. Sir, I want to speak for our outsourced healthcare workers. In Parliament questions and in last year's budget debate, I asked about outsourced healthcare workers serving on COVID front lines in our COVID wards. Same patient care area, same risk, facing the same virus. Can MOH provide an update on what is being done to better support our outsourced sisters and brothers in healthcare? Because every worker matters, including outsourced workers. Because in a pandemic, the virus doesn't ask to read your contract terms and conditions before deciding whether to infect you. We need to continue looking at this and continue improving. I also want to speak up for our young doctors who do long hours, long shifts on call. This can mean working a full day, sometimes starting at 6 a.m., sometimes earlier, working the whole night, and working for a significant part of the next day. Today's patients are more sick, more complex than when I was a houseman many years ago. There's also a much heavier load of electronic records, electronic messages, administrative loads as well for our young junior doctors. So we need again, Mr. Speaker, to seek truth from facts. We know in America, their house officers, their interns are more likely to have a motor vehicle accident at the end of a long shift. In 2007, 15 years ago, in the SMA News, I asked whether we should do more research into how the performance of healthcare workers is shaped by long shifts and sleep deprivation. Are hospital near misses more likely to happen towards the end of a shift? Does a night shift system change the pattern of near misses? The aviation industry, militaries around the world have studied the impact of sleep deprivation for many years. We can learn from this and see how we can improve safety and patient care in Singapore. I also want to speak up for healthcare workers who are caregivers at home, nurses who after a long shift looking after very ill patients return home and have to care for a parent who is ill with dementia, a parent who is themselves needing care. Young doctors who worry if becoming a mother will have implications for their traineeship journey. We must keep on looking at how to make our healthcare workplaces more family-friendly, because that is how we build a more inclusive workplace for healthcare workers across a diversity of backgrounds, a diversity of personal journeys. Sir, as I said during the debate on the President's address, healthcare is about our people's lives, your life and mine, the lives of our loved ones, the life of every Singaporean. We owe it to our fellow Singaporeans to keep our healthcare system fit for purpose, not just for today, but for tomorrow.